Welcome to the IntelliLearn video library, Paediatric Weight-Based Injections, Examples, Part 1. Prior to administering a paediatric dosage, 2 checks must be performed. The first check involves ensuring that the value in the dose calculation box on the order is within an acceptable range for the medication in question. You can do this with reference to the Paediatric Pharmacopoeia or another reliable and current source. In this case, you are giving gentamicin at 2.5 milligrams per kilogram per dose, which is an acceptable rate of dosage. The second check involves ensuring that the child's weight multiplied by the dose calculation is equal to the dose to be given, rounded to a whole number, which is shown in the dose box on the order. In this case, the child's weight is 28.5 kilograms, which when multiplied by 2.5 milligrams per kilogram per dose is equal to 71.25 milligrams, which is 71 milligrams when rounded to a whole number. Both checks have shown no errors, and since a medication order is also valid in that it contains all of the essential information and is clear and legible, you can now perform the calculation. To do this, you need to identify the dose that the patient must receive in grams, milligrams, or micrograms. This information is always provided on the medication order in the box labelled dose. You also need to know the strength, which is also known as a concentration, of the medication in question. This information is printed on the medication as 2 numbers, separated by a backslash sign, or sometimes the word per. The first number is a stock strength, and the second number is a volume in mils. Once you have this information, you can calculate the volume to administer, which is equal to the dose that has been ordered divided by the stock strength multiplied by the volume over 1. Let's now replace each of these quantities with their actual values by reading the medication order and the strength of the medication. The dose that has been ordered can be read directly from the medication order from the box called dose. The dose box specifies how much active medication the patient must be given in each dose. In this case, it is 71 milligrams. The stock strength can be found in the concentration of the medication. It is the first numerical value before the backslash sign. In this case, it is 40 milligrams. The volume can also be found in the concentration of the medication. It is a numerical value after the backslash sign and always specified in mils. In this case, it is 1 mil. The required calculation is shown. Before actually calculating the volume to administer, it is good practice to estimate the answer. You can do this by considering the dose required and the concentration of medication. The strength or concentration of the medication specifies how much active medication, in this case gentamicin, is contained in a given volume of solution. 40 milligrams per 1 mil means that every 1 mil of solution contains exactly 40 milligrams of gentamicin. In other words, if you were to inject 1 mil, the patient would receive exactly 40 milligrams of gentamicin. If you were to inject 2 mils, you would be giving 80 milligrams of gentamicin, which is more than the required dose of 71 milligrams. For this order, the patient must receive 71 milligrams of gentamicin, and therefore the volume to inject is between 1 mil and 2 mils. To perform the calculation with a calculator, you simply need to enter 71 divided by 40. There is no need to multiply by 1, as this will not change the value. Just press equals. The calculator will display an answer of 1.775. The 3 mil syringe that is available has increments of 0.1 mils, and so you must round your answer to the closest 0.1 mils to administer the dose. 1.775 rounded to 1 decimal place is 1.8 mils, which is a required volume to draw up and inject. This also falls within the estimated range of between 1 and 2 mils found earlier. Remember that you must always check the root box on the medication order, which will specify whether to give the injection IV, IM, or subcut. Please note that in your workplace, paediatric dosages may be expressed and/or rounded differently than demonstrated in this video. In your workplace, you must become familiar with and follow any and all guidelines and protocols that are provided.